anatomy, so am I supposed to write down questions?
No, I was trying to be funny, and I asked if anybody had any questions. I said, I know you guys ponder anatomy stuff. And then I kind of told a half joke, because I really do suspect over the weekend you do think about anatomy stuff. But I was like, Miss Monreal probably writes down questions to ask me on Monday, so to speak.
Okay, whatever.
So I guess that's a hard no. Okay.
Okay.
Anyway, today we're going to talk about the hamstrings. The hamstrings. Well, first, let me ask, let's do this. Miss Harper, what compartment of the thigh can the hamstrings be found in? What?
The posterior?
That's exactly it. Thank you. The question wasn't too clear, so I wasn't sure. They can be found in the posterior compartment of the thigh. That's what they fill up. Yes. They're found in the posterior. What does posterior mean, Miss Harper?
It means the back.
The back.
The back of your thigh.
Cool. Yeah, that's exactly right. Thank you very much. And by the way, everybody, this is the front of these hips, right? So, Miss Hunter, from where do we measure tilt of a hip? Like, what part are we looking to tilt when we measure tilt of a hip?
I'm sorry, can you please repeat the question?
Yeah, so hips are kind of round. Yeah. And so when they tilt, believe it or not, when the top part goes back, the bottom part goes forward. When the top part goes forward, the bottom part goes back. So which part do we use to talk about tilt of a hip?
Which part? Top of the hip?
Thank you. Thank you.
Okay.
We look at the top of the hip, everybody. So it makes sense that muscles in front, if they pulled, would create which kind of tilt, Mr. Kondaris? Muscles in front, if they pulled, would create which kind of tilt, Mr. Kondaris?
Anterior tilt.
Anterior tilt. And what does anterior mean, sir?
Front.
Front. Thank you. And it would make sense if we had muscles that grabbed onto the back of the hip, Miss Petrie. They would create, if they pulled, they'd create what kind of tilt?
Would that be a posterior tilt?
Yes, it would. Thank you so much. And what does posterior mean?
The back.
Yes. Now, by the way, this is very weird because your pelvis actually comes out front, but the back, the top part goes back, and that's a posterior tilt.
Okay.
These muscles, these hamstrings grab onto the back, and so they can create a posterior tilt.
So if the hamstring muscles are tight, they would pull the pelvis backwards to do a posterior tilt of the pelvis?
Yes.
Okay.
And again, I'm making such a big deal out of tilts because your pelvis receives your spine. You know, and if anybody's been in an earthquake, you know that what's happening at the bottom is really important. So if your pelvis changes, your spine changes a tremendous amount. Yep.
Can I ask a question?
I would love you to.
Okay, really quick. I want to make you guys jealous. Okay.
Okay.
Look at this beautiful foliage. Look at these golden leaves.
Miss Monreal?
Yes?
That is super beautiful, but I feel like you set us up with a lie. You said, may I ask a question? And then you made a statement.
Well, yes, here's my question.
Oh!
You're not going to have an answer. Okay?
Okay.
Because, just whatever. Anyway, maybe you will have the answer. Okay, so, and this is just the way my brain works. Okay, but what causes the muscles to, so even like, let's just say in a posterior tilt, why would that be so tight that it's going to cause the hip to do that? Like, is there another cause to make those do that? Yes, you do have the answer.
I do.
What?
I actually have a pretty darn good answer for this one. Okay. If a train is traveling from Seattle at 100 miles an hour into a headwind. No, the answer is the answer is that because and I'll show you this later to make sense of it. But the answer is that when you are in a seated position, strangely enough, with your knees bent, it can allow the hamstrings to shorten. So that when you get back up again, they're short and they're tight. And strangely enough, the seated position at a chair can allow for your hamstrings to actually shorten and your rectus femoris to shorten.
So then that would be like a chronic thing then, that if somebody was always doing that, then it's going to take its toll?
Yeah, it could.
Okay.
Yeah. So that'd be one thing. The other thing is they could be tight because they're trying to fight an imbalance in my body. So let's suppose, I don't know, hypothetically speaking, that Mr. Tapscott's like, hypothetically speaking, 30, 40 pounds overweight. And let's suppose, hypothetically speaking, it's hard to imagine, but most of that's in his stomach. That's going to pull my hips forward, right? That's going to cause an anterior tilt, right? What do my hamstrings try to do? They try to get my belly back. And that's going to cause them to be tight just in fighting that weight imbalance in my body that I have created with red wine and Cheetos at 10 o'clock at night. Yes, it's not Cheetos, but it doesn't matter. It's a lot. Yeah. Cheese. Used to be cheese. Yeah. So, does that help, Miss Monreal?
Yes.
Cool. The hamstrings, by the way, because they're in back too, are often overlooked. And like when people go to do squats and things like that, they're like, it's a quad exercise. Yes, squats is an entire leg exercise. They use almost every muscle in your thigh. They use your inner thighs because your legs actually have to pull together for you to go up. They actually use your quads because your knees have to straighten out. But they use your hamstrings. In fact, your hamstrings provide 60% of the power over your quads, but only provide 40% of the power because your hamstrings are what pull my hips up so I can straighten up again. So your hamstrings are powerful hip extenders. Any other questions before I move on? No? Oh, did you raise your hand? Miss Petrie?
Yes, it says.
I know, I just saw that feature today. I love this feature. Okay, Miss Petrie, thank you for raising your hand. What is your question?
So if your quads and your hamstrings are both tight, which way is your pelvis going to tilt?
I mean, it depends on who wins that battle, right?
Okay.
So, and I don't know the answer to that. I mean, whichever one's stronger or whatever. But,
Okay.
does that mean the rectus femoris is an antagonist of the hamstrings? The hamstrings can be an antagonist to the rectus femoris.
Absolutely.
Yes. So these are muscles that can fight each other. And that's
Okay.
that's good to know.
So it's just like a tug of war then?
Mm-hmm. Well, by the way, you might
At
only
that
have
point?
one that's tight, and that could cause the pelvic tilt problem. But if they're
Okay.
both tight, it probably depends on who wins. By the way, the hamstrings would probably win against the rectus femoris.
Okay.
Rectus femoris is only one quad, and the hamstrings are actually 3 heads fighting against it.
Okay, well, thank you, Miss Petrie, for now making me wonder other things.
Miss Monreal, did you raise your hand?
Oh, sorry. Yeah, but I don't have my camera on.
I'm teasing. Well, actually, she didn't raise her hand. She used the raise hand function. We now have this really cute thing on our screens where we can raise our hands.
Oh, I don't know where oh, I see it. Okay. Learn something new every day. I can get off this call now.
So,
Okay.
yeah.
So, in what type of scenario would those two be tight and fighting each other? Like, what would someone have done to create that?
I am guessing that it would be like a lot of other scenarios in your head. So let's suppose I sit at a desk a lot, and for whatever reason, when I'm sitting at the desk, I really have a strong anterior tilt because I'm sitting at the desk, and my rectus femoris tightens. So now my rectus femoris tightens, and when I get up, I've got this strange back position because I can't get up all the way. Your body is smart. Your brain is very smart. It knows exactly where you are in three-dimensional space, and it's trying to balance you out all the time. This is why when you walk down the hallway, you don't have to think about balancing. So anyway, this is a very hard position to be in. And my brain's going to kick in my hamstrings to try to straighten out against the rectus femoris. And so I could see that kind of causing some fighting between the two. That's just one example, right? My point is the fight is coming from your body trying to pull you back into good posture.
Okay.
You want something a little more exciting?
No, not at all. I'm just I try to put the picture in my head of like, okay, well, what's going on when that happens? But yeah, you explained it. I get it.
Cool. Okay. Any other questions? These are good questions. Yeah? No? All right, let's remember some stuff about the leg bone before we go further. Okay? This is half a hip. This is the right hip, and you are looking at the back side, the posterior side of the hip. Okay? Yeah. Yeah? Good. Hey, Miss Yanes, what is this part of the hip called here? This bone? You know, the hip's made of 3 bones. What's this one on the lower posterior side called?
Is that the pubis?
That would be in front, up here, but remember this is behind. Your pubic region's not behind you. So what's this thing back here that you sit on? Sometimes it's called your sits bone.
Ischium.
Ischium. Thank you very much, ma'am. By the way, everybody, there's a lot of little bumpy stuff on this ischium. There's bumpy stuff right here. This is called the ischial tuberosity. It is bumpy because 3 of the 4 heads of the hamstrings insert here. They grab onto this. This is a powerful handle for the hamstrings to grab onto. That's what it's here for. And this is called the ischial tuberosity. Yep. Miss Hanson, what is this called right here?
The ischium tuberosity. Say that word again.
Have you been drinking this morning, Miss Hanson?
What?
It is the ischium. This is the ischium bone, and this is the ischial tuberosity. Ischial tuberosity. Cool. All right. Boom. Miss Torres,
Yes.
what bone is this?
Your femur.
It is your femur. Largest, strongest bone in the body. Lots of red and white blood cells get made inside here. And which side of the femur is this?
Your posterior.
Thank you. Thank you, thank you. Posterior. And this would be posterior middle, right? The posterior middle of your shaft of your femur. Very cool. Thank you. Thank you, thank you, thank you. Miss Baladik, do you know what bone this is here? This big, thick bone on the medial side of the leg? Because this is the right hip, so there's another hip over here. This bone on the medial side of the lower leg, because you got 2 bones here. Starts with a T.
The tibia?
Yeah, thank you, ma'am. And Miss Stanley, do you know what this little thin lateral bone is called?
Is that the fibula?
It is the fibula. Thank you very much. Thank you, thank you, thank you. And Miss Monreal, do you remember what these bumps on the sides of, the sides of either one of these, by the way, but the sides of the tibia are called? We have bumps at the end of bones. Do you know what these bumps are called? On the lateral and medial side? What?
Are they condyles?
They are condyles. Thank you very much. Condyles. Yes. Yes, yes, yes. I love that. What's this condyle on the medial side called?
Yikes. I don't know.
Well, do you want me to give you 2 choices?
Yes.
All right, either Henry or medial condyle.
I'd be inclined to go with Henry, but I'm going to go with medial condyle.
You're on fire today. Good. Yeah.
Okay.
Medial condyle. Thank you for letting me be a smartass. I'm just playing with you. Medial condyle, cool. Awesome. And hey, by the way, and this is very hard to see in the camera. Let's see. Let me go to somebody. Miss Felix Osuna. What side of the tibia is this?
That's the front.
Well, I'm sorry. No, I'm holding this hip backwards. So
Okay. That would be the heel.
posterior?
Posterior.
Yeah. This would be the
Lateral.
medial. Yeah. Sorry, it's hard because it's backwards. But your fibula is on the lateral side. So this is the medial side of the shaft here. So guys, I'm showing you this stuff because we're going to find out that most of let me back up here for a second. Miss Nguyen, I have a very hard question for you, and I apologize, but you're next in line.
Yeah.
Miss Nguyen, how many hamstrings are there?
3 hamstring.
How many heads do they have?
I don't know.
What?
Please repeat the question.
Oh, how many heads? How many heads do they have? So there's 3 hamstrings, but how many heads total are there?
I think about 4.
Yes, there are 4, right? Because the biceps femoris is 2. So the biceps femoris is like 2 muscles, really, right?
Yeah.
Biceps means 2, and then semimembranosus is the 3rd one, and the semitendinosus is the 4th one. They don't have to go in that order, but that's where you get 4 heads from. I'm telling everybody this because what we're going to find out is essentially 2 heads run down the lateral side of the leg and 2 heads run down the medial side of the leg. Which makes a lot of sense later because they're going to pull on both sides of the knee, and that'll kind of keep the knee in alignment. Yeah? Okay. So, on the lateral side, Ms. Cooper, which hamstring do I find on the lateral side of the leg?
The lateral one?
The lateral one, that's right. Which hamstring do I find on the lateral side of the leg? I mean, they're all, by the way, they're all on the posterior side, but on the lateral posterior side of the leg.
Oh, I seriously just thought it was called like lateral
Actually,
hamstring.
by the way,
Like I wasn't
this is flipped. This is the left leg, so this is the lateral one. What hamstring is this? This one right here. I wonder if this will come off.
I don't know.
Yeah. Well, what are the names of the 3 hamstrings?
I don't know.
One's a 2-headed muscle on your femur. What's the word for 2?
Bye.
Yep. What's the word for heads? Remember my biceps brachia? What's the word for heads?
Bicep femoris.
I'm so sorry, what?
What, the bicep femoris?
Yeah, the 2-headed muscle in the femur. That's one of the hamstrings. Biceps femoris. And then there's the
Tendinosis?
Yep. And
Membranosus?
Cool. Which one's most medial?
The semimembranosus?
Awesome. Very good job. So, by the way, the semimembranosus and semitendinosus are very close to one another. So those are the ones on the medial side. This is a left leg. So this is the medial side. This is the, well, I don't want to get them mixed up here. This is the semimembranosus. This is the semitendinosus. This is the biceps femoris over here. And if I take this part off, this is the second head back here. It's really hard to see, but this is the second head underneath this head. So, you guys, we have two heads. Apparently I didn't need to unscrew this at all. We have two heads on this lateral side coming down. Biceps femoris, short head and long head. We have two heads on the medial side coming down, semimembranosus and semitendinosus, grabbing onto both sides of the knee. Yeah? Yeah. So I'm telling you this later because it helps you kind of identify these muscles. Also to realize you've got these muscles pulling on both sides of the knee to help with knee alignment. So Miss Monreal, this is especially for you. So if somebody was having problems with their knee not tracking right, it could be because their biceps tendinosus and membranosus were fighting with their their semimembranosus, semitendinosus was fighting with their biceps femoris and pulling the knee offline, because if it doesn't pull evenly, you don't have good tracking. Yeah?
Thank you, yes.
Cool. And actually, Miss Monreal, right up in here, where the muscles come together, they're coming up here to insert into the ischial tuberosity, right up here. That's the ischial tuberosity here. It looks a lot different with a lot of stuff attached on it. The fascia right here can get glued together. And so sometimes we'll actually take an elbow. We won't drop it right here because there's veins right here, but we'll drop it right in about here, and we will slowly go up right between here. One of the most pleasant feelings you'll ever have in your life. Very similar to having your hair stroked by your mother, just gently when you were a small child, with a summer's breeze rolling across you and the smell of dandelions. And it is excruciating, but it is very effective for athletes. And sometimes we'll even flex and unflex we'll flex and extend your leg while we're doing it to kind of move these muscles back and forth to cut this open we're not really cutting it, all right?
Right,
But tear and shred this open. That's what we're doing. Forget about cutting. And we shred this thing open, and it separates those two things so that your brain once again can pull on one and not the other, so they're not pulling on each other. It can help with knee tracking. Kind of cool. So whoever your lab partner is today, try that on them. Okay. So really quickly, we're looking at the back of a leg right now. We're looking at it from the back, because there's the patella in front, right? Back, posterior side. The lateral side is always the fibula. On the outside of your leg is always the fibula, right? So, where was I? Oh, forgot. I forget that I was used to using a touch screen at my house. So I'm like trying to touch the screen, make it work. Miss Harper.
Yes, sir.
Can you name the hamstrings from lateral to medial?
From lateral, okay. The lateral side of the hamstring is the biceps femoris.
Yep.
I think. And then the middle is the semimembranosus, and then the semitendinosus.
Yes, but they would go biceps femoris, semitendinosus, semimembranosus. But you are right. Semimembranosus, semitendinosus are over here on the medial side. You're absolutely right.
Okay.
So let's go back. So since you know, without looking at the book, this is for everybody's help. This will really help you guys you'll never have to look at the book again about these muscles. Since we know the biceps femoris is on the lateral side, what bone does it probably insert into?
Maybe on the fibula.
Because it's on the lateral side. Yeah.
Yeah.
And what bone do we think the semimembranosus and semitendinosus insert into?
The tibia.
Yeah. Hey, what's the most medial aspect of the tibia? The thing that is most medial on this tibia, that sticks out most medially?
Is the part of the tibia?
Yeah. What's this called right here?
It's a condyle.
It is. It's the medial condyle
Medial condyle.
of the tibia. What hamstring muscle do you think would go into the medial condyle of the tibia? The most medial part of the tibia.
The semitendinosus.
What's the most medial hamstring muscle?
You said semitendinosus.
What's the most medial hamstring muscle?
Semimembranosus.
Thank you. Membranosus, medial epicondyle, Membranosus, medial condyle. Cool, cool, cool. So that's just a way that I kind of remember this stuff. I know that almost all of them hook up to here, to the, what was this called again, Miss Hanson? I forgot.
The ischium.
The bone is the ischium, and this, what's this tuberosity called?
What? Say that again? What did you just say?
I love you. Ischial tuberosity.
Oh, ischial tuberosity.
I know. All right, so 3 of the 4 heads attached to the ischial tuberosity. Both of the semimembranosus, semitendinosus do, because look how medial this thing is. They grab onto this thing, they come down here. The semimembranosus likes to grab on to the most medial part here, right? Semitendinosus actually comes down around and grabs onto the medial part of your tibia down here, not the most medial part, right? But this medial side. And I suspect you guys all saw something very unusual in your book. It said the semitendinosus inserts into the medial proximal shaft of the tibia. So this is the shaft of the tibia. This is medial. Remember proximal? Proximal is closer to your body. This would be the distal part. So proximal. Into a thing called the pes anserinus. What? That's a lot. So, I'll tell you what the pes anserinus is. But first, let's remember. This side is medial. Proximal means closer to your body. So this bone has 2 ends, a distal end, a proximal end. This is medial proximal, right? This is posterior proximal. This is anterior proximal. This is medial distal. But anyway, it goes into the medial proximal place here, into a thing called the pes anserinus. Pes anserinus means goosefoot. And there's a place down here on the inside of your leg, below your knee. You can actually feel it on your knee. If you kind of come in here and rub right down in here. And actually, I don't know if you'll be able to see it. It is shown here. It's right here. It's 3 tendons that come together, and so they look like a goosefoot coming out. And they all insert, and if you rub the inside of your knee in this spot, it will be quite tender. It will feel like bone, but it will be quite tender. So it's underneath your knee, right here on the inside of your knee, you'll find this nice tender bony spot. It'll feel kind of awkward.
Should somebody rub it? Does it do any good?
Yeah, because the tendon attachments there are highly avascular. What does avascular mean, Miss Monreal?
Not without blood, but is what we would think. So
Right.
less blood.
Yes, less blood. The word means without blood, but yes, an area of less blood, because tendon attachments are very strong, but they're very strong because they're very dense, and they're very dense, they don't get a lot of blood into them. Well said. So, anyway, the pes anserinus is made up of 3 tendons coming together. They kind of triangulate here. One is your semitendinosus coming down in here. One is an adductor muscle, the longest adductor muscle. Miss Hunter.
Yes.
Do you remember which adductor muscle is the longest adductor muscle, and it's not the one named the longest?
Is it Magnus?
No, that's the biggest one, but not the longest one. This one is the only one that crosses over the knee.
I don't remember the third one. Longest, Magnus, and I don't know the other one. Sorry.
No, don't be sorry. I'm not growling at you. I'm trying to give you a clue.
Oh, gracilis?
Yeah, gracilis.
Oh.
So the gracilis comes out here. So the semitendinosus, gracilis, and this is the sartorius, believe it or not, coming down here, and they all insert to form the pes anserinus. Helps create internal medial knee stability. Because think about it, they triangulate down in here to help protect the inside of your knee. What's protecting the outside of your knee? Anybody? What gives you outside knee stability? Inside, you got this kind of pes anserinus thing going on here, stabilizing this side. What gives you stability on the outside of the knee?
Is it the IT band?
It is the IT band. So, I mean, nobody would know what you're talking about if you said this, but this is kind of like, the pes anserinus is kind of like the IT band of the medial side of the leg. Kind of. Stability, because knees are not, they're funky, you know. They take a lot of pressure and they don't like sideward movements, and so this stuff is kind of holding your knee in place. So I told you guys all this because it really helps you remember origins and insertions for these muscles. You've got two heads on this side, two heads on this side. You've got on the medial side, you've got a semitendinosus and a semimembranosus. On the lateral side, you've got the long head of the biceps femoris and the short head of the biceps femoris. One muscle, but two heads. Two heads that come down here and attach in here. So you've got two heads on both sides that create knee stability. All three muscles insert into this thing up here. What's it called, Miss Hanson? What's the thing up here that they all have origins on? Or
The ischial tuberosity?
bam, that was really good. Now you're just showing off. All right. They all insert into the ischial tuberosity up here. The only difference, the only one that doesn't insert in the ischial tuberosity, it's still, the biceps still does, but one of the heads of the biceps femoris does not, and it actually inserts into the back of the femur. So, I'm going to say some things and then I'm going to ask some questions.
Real quick before you say things.
Oh, good.
So one of the heads of the bicep femoris inserts into the back of the femur, is what you just said, right?
Yes, it has an origin. I should have said an origin. It still crosses over the knee, but it doesn't cross over the hip. It hooks into the back of the femur. Yeah. So that's the short head of the biceps femoris. So what would the action of the short head of the biceps femoris be, Miss Monreal?
To, hold on, I'm picturing it in my head. To medially rotate the knee? I don't know.
Well, I mean,
No?
What would its main action be? It crosses over the knee. What's it going to do to the knee when it flexes? When it contracts?
If it crosses over the knee?
And it's on the back side of the leg, yeah?
Well, I mean, it's gonna flex the knee, right?
Yeah, knee flexion.
Okay.
Yeah.
Okay.
Is it going to do anything to the hip?
Is it gonna extend? So is it not gonna do anything to the hip?
That's right. It's not going to do anything to the hip because it doesn't attach to the hip.
Oh,
Sorry, I was trying to make a point.
right.
The other three heads attach to the hip, and so they do stuff to the hip and the knee. That little sucker only flexes the knee. All four flex the knee. All four heads flex the knee because all four heads cross the knee, but only three heads cross the hip.
Okay, so if you were flexing the knee but not extending the hip, would you mainly just be using that one, or they're all still working together?
They're probably all still working together again because of knee tracking.
Okay.
Because you don't want to just pull on one side of the knee, right?
Okay. Yeah. Okay.
Cool. All right, so let me ask some questions. Mr. Kandaris. And I need you guys to be precise on these answers too. So I need you to also kind of talk about, like, no longer are we just talking about semitendinosus and semimembranosus and biceps femoris. We're really talking about semimembranosus, semitendinosus, biceps femoris, long and short head. Because there's two aspects. So I want to talk about the four heads. Semimembranosus, semitendinosus, biceps femoris, long head, biceps femoris, short head. Cool. Mr. Kandaris. Which hamstring muscles and heads create an extension of the hip? Good, sir. Mr. Kandaris. You're not sleeping in the hammock, are you? All right, we will come back to you, Mr. Kandaris. Hold on. Dun, 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 dun. Okay. Miss Petrie, which of the hamstrings and heads of the hamstrings can create a extension of the hip?
It would be the long head.
Long head of what?
So I thought, is that what the question is? The long head of the biceps femoris.
Definitely can create an extension hip. Anything else, or is that it?
Oh, okay. I'm sorry. I thought that's what the question was.
The question is, which hamstrings and heads of hamstrings can create an extension of the hip? The leg going back here.
But wouldn't it be biceps femoris, long head, the semitendinosus, and the semimembranosus, but not the short head because it doesn't attach to the knee or to the, right?
They grow up so fast. That's exactly right. I mean, that's exactly right, Miss Petrie. That's exactly right. That's exactly the type of thinking I'm talking about. Yes. Yes.
Okay.
Thank you. That was really well done. That is a trick question. Like that's an anatomy. Like when they really want to put something on a test, that's the kind of stuff we ask you to see if you really understand the concept. And you're right. The one that doesn't do it is the short head because it doesn't go across the hip. The short head only does one thing. All the other heads do two things. Sorry. The other three heads do two things. Very well done. Really. Yeah. Cool. Yeah. Miss Giannis. Of the four heads, which ones create a flexion of the knee?
The short head, the biceps femoris. The semimembranosus, the semitendinosus, and the long head does too, right?
Yes, thank you. So all four create a flexion of the knee. Three create an extension of the hip. Thank you both. Really good. Really good. Cool. Yeah. Oh, wow. I feel so respected. Yes, Miss Petrie, I see you have your hand raised.
I had a question, and I asked someone to raising the hand, I forgot it.
You got so excited.
I was going to ask, oh man. Okay, so are we counting the biceps femoris as two, so it's biceps femoris, then biceps long head, and biceps short head?
Are we
Is
counting
that
as
how we're explaining this? Or is
in this case where we need to be this precise? Yes.
Okay, so not only would you call biceps and semitendinosus, semimembranosus, but then you also talk about the long head and the short head as individual?
Yeah, because they have different origins and different actions, right?
Okay, so when you're answering some of these questions, you have to say biceps femoris, semimembranosus, semitendinosus, and then biceps femoris, long head, biceps femoris, short head.
Yeah, it would be very common to say, if you want to be really precise, talking about the hamstrings, quite often we would say semimembranosus, semitendinosus, biceps femoris, long and short head. That's the group, right? And biceps femoris is technically correct, but if people are starting to ask you about actions, then you have to get that precise. Because the short head does not extend the hip, it only flexes the knee. The long head does both, that kind of stuff. That's why we answer that way. Yeah. Cool. All right. So, let's review. Miss Cooper, what are the three hamstrings?
Well, the bicep femoris, the semitendinosus, and the semimembranosus.
Awesome. How many heads does the bicep femoris have?
2.
Thank you. Which side, all four are found in the back of the leg, but which one is found most lateral on the leg of these muscles?
The semitendinosus.
I'll give you two more guesses.
The membranosus would be in the middle.
I'm glad you said that. So very, very respectfully, you're wrong, but very, very respectfully, I'm glad you said it because I forget this always comes up for everybody. So don't feel bad at all. Middle and medial mean two different things. And it's really easy to get them confused, right? Let me give you an example. Okay. This is the middle part of the femur. I'm in the middle of it, right? This is the medial part of the femur. It is close to the midline of the body. It is close to the middle of the body, but medial means close to the midline. Middle means in the middle of whatever object you're in. And so that gets very confusing, huh? So your semimembranosus, which likes to hang out very closely with your semitendinosus, is found on the medial side of the leg. The biceps femoris is found on the lateral side of the leg, and it's very easy to confuse medial and middle. So thank you, Ms. Cooper. This is actually very helpful. Something I should have clarified a while ago. So anyway, found most lateral is the biceps femoris, long and short head. Cool. Cool. We're doing good. And because the biceps femoris is found on the lateral side of the leg, Miss Nguyen, which bone does it probably insert into? It would be the bone found on the lateral side of the lower leg, right? And what's that bone, Miss Nguyen, that the bicep... oh, go ahead.
I think it's the femur.
Fibula.
Yeah.
If you said fibula, you're correct.
Yeah, femur.
No, not femur. Not femur.
What?
La.
Fibula.
Yeah, fibula. Fibula. Cool. And the fibula is on the lateral side of the leg, so that makes sense, right?
Yeah.
Cool. Cool. And Miss Felix Osuna?
Yes.
All four of these heads are found on the posterior side of the leg, but which two of these muscles are found medial, more medial than the other one?
Semimembranosus is in the medial side.
Yep.
And so is maybe the semitendinosus.
Yeah, they hang out together. I admit the semimembranosus is even more medial, but they hang out together. They're both found on the inside of the leg, that medial side. So when I'm rubbing up somebody's leg, I can actually know which ones I'm on. That's why I'm doing this, everybody. And since Miss Felix Osuna, they are found kind of on the medial side of the back side of the leg, which bone do they probably insert into? In the lower leg, what's the more medial? Go ahead.
The ischium.
Well, they start at the ischium. You are 100% correct. Sorry. Down here, what's the bone that's found most medial in your lower leg?
The fibula.
That's lateral.
That's the tibia.
Tibia. Tibia is big and medial. Cool? All right. So let me explain one other thing, everybody, just so you can visually see it. This is a left leg. This is the most medial side where the pes anserinus is. The semitendinosus actually kind of comes down and wraps in like that. Oh, jeez. It actually comes down behind the knee and wraps into the medial proximal shaft of the tibia. That's the semitendinosus. The semimembranosus, by the way, just comes down to this condyle down here, right about there. But it wraps around behind. So you could actually rub this on somebody and then work your way up. I just want you to be able to visually see that, because when they talk about it in your book, it's so confusing. They're like, it inserts into the medial proximal shaft of the tibia via the pes anserinus, and that's true, but you have to kind of imagine it's coming back from behind and grabbing here. So it still flexes the knee. It works just fine. Gives a lot of support to it, actually. Yeah? Kind of wraps. That's the semitendinosus right there. Semimembranosus stops more back here on the condyle. All right, let's go through a little slide presentation because I'm seeing some people gloss over here. Yeah. Oh shoot. Hold on. Okay. Hamstrings are truly, truly important muscles. That's why I'm making such a big deal out of these guys. Okay. We can all see the slide presentation. If I were to present it to you, you'd be able to, huh? Let's see. Let's try this again. Present now. Window here. Boom. Boom. Cool, cool, cool. Da, 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 da. Mr. Kandaris, you back with us, by the way, sir?
Yes.
Oh, good. Okay. Hey, since I've got you, sir, what hamstrings and heads of hamstrings, I want you to be really precise, whether it's long head and or short head of the biceps femoris and semimembranosus and semitendinosus. So you've kind of got 4 answers to choose from or combinations of those 4. Semimembranosus, semitendinosus, biceps femoris long head, biceps femoris short head. Which ones of those create an extension of the hip?
The long head of the biceps femoris.
I like where this is going.
Yeah.
Yeah, you're off to a great start.
Oh, and the long head of the semitendinosus.
Is there a short head to the semitendinosus?
Huh?
Is there a short head on the semitendinosus?
Isn't there?
Well, it's not called the biceps semitendinosus. There's only one two-headed muscle.
Oh, right. Yeah, the biceps.
So you said so far we've got long head of biceps femoris, and then do you want to add to that?
No.
Okay. So why? By the way, why does the long head of biceps femoris cause an extension of the hip?
Because it's where it attaches.
Yes, that was an excellent answer, sir. Because it attaches in the ischial tuberosity. You're absolutely right. It has an attachment site in origin, but it doesn't matter if it's an origin or insertion. It has an attachment site on the ischial tuberosity, which is part of the back of the hip, and so it causes an extension of the hip or a posterior tilt of the hip. Well done. Do any of those other muscles have an origin or attachment site on the ischial tuberosity? Because if they do, they should be in your answer. But you're exactly right. Long head. Oh, go ahead, sir. Go ahead.
I just said probably.
Yeah, probably. Okay, cool. You are absolutely right, sir. So long head of biceps femoris and the semimembranosus and semitendinosus all extend the hip. Cool. Let me ask you one more question, and that is, which ones of those 4 heads, 3 muscles but 4 heads, flex the knee?
Semimembranosus.
Yeah. And that is because why?
No. It just feels right. It's more medial.
It is medial, and it inserts into the tibia. It inserts into the posterior medial aspect of the condyle of the tibia. And so that is, yes, it crosses over the knee joint and inserts into the tibia. Is there any of those other muscles cross over the knee joint?
No. Or no, the semitendinosus does as well.
Yes, semitendinosus does as well, kind of on the medial side as well. Semitendinosus likes to wrap around the back, come around the side on the medial proximal aspect of the tibia into the pes anserinus, which means goose's foot. Cool. So we know the semimembranosus and semitendinosus help you create a flexion of your knee. Does the biceps femoris long or short head help to create a flexion knee? Do they cross over and insert into something like the fibula or something? Just throwing stuff out there.
Short head.
The short head definitely crosses over the knee too. Yes. Maybe the long head too, just for kicks?
Sure.
Cool. All right, so 3 muscles, but 4 heads cross over the knee, 2 on each side to create knee balance and stability, and they flex the knee. 3 heads go up to the ischial tuberosity and extend the hip. So 3 heads can extend and flex the knee. 1 head can only flex the knee. Yeah. And that is the short head of the biceps femoris. By the way, anybody know the nickname for the hamstrings?
Hammies.
Hammies! Actually, that's true, by the way. A lot of people call them the hammies. Good answer. Not the answer I was looking for, but it is actually true. People call them the hammies all the time. Yeah. Anything else? Any other people? That's the most adorable answer. Mine's a little more technical. I don't know if you guys can see. I'm going to try to tune this down just for a second so you can see something. Let's see here. So, hopefully you can see my legs now. When I walk, I do several things. Lots of things, by the way. Lots of things. And we'll get into this later. But one of the things I do as I walk is I pull my leg through. What's this action called, by the way? Who can tell me what I just did right there?
Is it an extension and a flexion?
Well, I'm getting ready to flex, but you're absolutely right. Extension of what, Miss Petrie?
The extension of the hip.
Yep. And if I do this, then I'm doing a what?
It's still an extension.
Right, but what's going on down here?
Oh, you're doing an extension of the knee.
That?
Oh, no, I'm sorry. A flexion of the knee?
Yes. So an extension of the hip, flexion of the knee. What are the 2 actions of 3 heads of the hamstrings?
To flex the knee
And you
flex
just
the hip.
extend the hip?
Extend the hip.
Yeah.
Sorry.
No, it's okay. It's very confusing. But anyway, you're dead on right. And guess what I do when I walk? I actually extend my hip and flex my knee. Extend my hip and flex my knee. Extend my hip and flex my knee. Right? I do a lot of other things. But for that reason, they're called the walker's muscle.
Oh.
Walker's muscle, because you actually use them. And by the way, if you don't believe me, I don't mean you specifically, although I can tell that you don't believe me. If you don't believe me, try to walk fast really someplace, not jog. Because once you jog, you come up on your calves. Try to walk fast. And what you will feel is your hamstrings.
Oh, okay.
Totally. I mean, just do it for a minute, as fast as you can, and you'll feel your hamstrings. They are the things that help you to walk fast. Yeah.
Okay, I thought it was going to be something different, like goose foot thing or something. I'm like,
Oh,
what
something
is
kind of
it?
cool. Yeah. No, it's not like Pez rice. No, they're just called the walker's muscle because they actually really have a lot to do with walking. A lot of your power from walking, not running. Because once you run, you start to kind of go forward on your calves and your quads. And don't get me wrong, hamstrings help with that too. But your hamstrings are your major walking muscle.
I like Miss Cooper's.
Hammies. Yeah.
Yeah.
Miss Cooper's
I like that one.
was more fun. But it didn't tell you anything about them. It just was adorable. This way you know, like, oh, they're the walker's muscles because they extend your hip and flex your knee. Yeah. Okay. So let's go here. Okay. So here I am looking at which side of the leg, Miss Cooper, Miss Hammies, which side of the leg am I looking at here?
Looks like the posterior.
That's right. What does posterior mean?
The back.
Yes. Posterior is where your rear ear is. Yes. The back side of the leg, right? And we can see the hamstrings back here. Now this is very interesting Remember that the quads, your quadriceps femoris, weren't just on your anterior side of your leg, they're on your anterior and lateral side of your leg. So the hamstrings are bordered by a muscle on the lateral side and a big muscle on the medial side. A big muscle on both sides, actually. Who can tell me what muscle is on the lateral border that kind of boxes in the lateral side of the hamstrings? It's not the hamstrings. I mean another muscle from another group that kind of creates this side of the wall of the hamstrings. This muscle right here. Lateral side.
Vastus lateralis.
Vastus lateralis is 100% correct. Thank you. Ms. Torres, you're going to say vastus lateralis too?
Of course.
Of course you were. Okay. And on the medial side, there is a big, giant muscle that kind of borders the medial side too. Anybody know what that one is? It's not the gracilis. It's much thicker. It's massive on the medial side. Yes, Miss Cooper?
The gluteus maximus?
Nope, that's way up here. And that's lateral.
Okay.
This is on the medial side of the thigh.
The Magnus?
The magnus, yeah. So these muscles are kind of boxed in by the vastus lateralis and the adductor magnus. And they live right here. And you can actually grab them on people like this. You can kind of wiggle your hand down there and grab them. Try and stay on your partner. And by the way, I know we don't rub the back of the knee right in here, but that doesn't mean we don't come off to the sides and get this avascular material. You can massage these and come down around the knee. Totally. In fact, you should. So, cool. Ba-da-ba-ba. Da-da. Okay. Here is a beautiful picture of a right leg posterior view. We are looking at the back side of a leg. It happens to be the right leg, right? We can see the two lateral heads of the biceps femoris, long head and short head. They are lateral, so they both go and insert into the most lateral bone on the lower leg, which is your fibula. We can see the semimembranosus and semitendinosus on the medial side of the thigh going down into the tibia. Was somebody about to say something? Yes, Miss Monreal. No?
No.
You got me excited, and then you changed your mind.
No, I didn't know my mic was on, so I'm sorry.
Okay, don't be sorry. You're fine.
I can say something if you want. I'll make it up really quick.
Good. Make up something really quick.
No, I'm just kidding.
If it's a Tuesday, what would make that muscle tight? Anyway, and we see that basically all three of these muscles insert into the ischial tuberosity. Only three heads do, but still, that's where they cross over the hip, and they can actually pull the hips back to do a posterior tilt. I saw a lot of interesting answers on the homework about this tilt. I saw people say it can pull the hips back, which was true, and therefore it's an anterior tilt, which made me bang my head against the wall. I even saw somebody say they can create an interior tilt, which I don't know what an interior tilt is, but let's just be clear, it's a posterior tilt. They grab on the back of the hips, and that causes the hips to crunch under like this. They pull down on them, and that causes the hips to rotate back from the top. Posterior tilt. Hey, interesting question. What do posterior tilts do to the curves of my spine? What do posterior tilts do to the curves of my spine? It's the opposite of what anterior tilts do to the curves of my spine. This is an anterior tilt, this is a posterior tilt.
Exaggerate them?
Which one? The posterior.
Lordosis?
Oh, I see what you're saying. Sorry, I'm sorry, I didn't mean that.
Sorry.
I meant, are you saying the posterior one exaggerates curves of my spine?
The posterior.
Okay, well let's look. This is me doing an anterior tilt. Oh, this is me doing a posterior tilt.
Oh, okay. Well, I mean, the first time I thought you were tilted back more, but
So
I don't know what you want from me. I don't know what you want from me.
I want the right answer. What? What does a posterior tilt do to the curves of my spine? Miss Monreal?
Yeah, I'm still thinking.
What? Look at me again. This is me anteriorly tilting, not posterior. Anteriorly tilting. Oh God. Okay. This is me posteriorly tilting. What does anterior tilting do to the curves of my spine? How about that?
Well, I mean, I feel like it's straining them both. I guess that's why I'm having a hard time.
Yeah, and I'm sorry, actually, you're right. So anterior tilts exaggerate the curve of your spine.
Okay.
Anterior tilts exaggerate the curve of your spine. Posterior tilts remove curves of your spine.
Okay.
I'll show you guys. Hold on.
Yeah, I mean, I guess. I'm
What do you mean, you guess?
trying
Of course.
to. Yeah. Okay.
So, really quickly. All right. Your hips, by the way, are always at a slight angle. Kind of like this. This is front here, okay? Here's your femur down here. Here's your knee. Here's your little cute foot. This is your spine. Okay? This is how your hips are normally. By the way, your hamstrings hook on back here. Your hamstrings hook on back here. Your rectus femoris hooks on up here. If I pull this thing down even further, if I create a hip, I should get rid of this thing. I can't. If I create a hip that's even more anteriorly tilted, it wants to throw my head out here. My head can't be there, so my head has to get over here. And the only way my body can do that is to really exaggerate these curves. That's unbelievable. If I posteriorly tilt and get my hip kind of flat like this, I don't need a curve at all to get my head above my hips. So posterior tilting removes curves from your spine, anterior tilting exaggerates curves in your spine.
Okay, well, I guess this is where I'm having a hard time with it. Okay, but we're not going to walk around like that, correct? So our body is still going to throw our upper part back.
Yes.
Correct?
Yeah.
So I guess in my head, that's why I'm still thinking of a curve, because once our body throws it back, there's still a curve. Even though I agree with what you're saying, it is diminished.
Well, of course. I didn't say they disappear. I said they diminish.
Okay. Well, I'm like thinking you were saying like there wasn't going to be any curve.
No, but your curves are good, by the way. They actually are shock absorbers. You've got a little one in at the neck, one out at the thoracic region, one in at the lower back. And this is how you're designed to be. With a little tilt in your pelvis, this is how you're designed to be. But can you see, since my spine stacks up on this, if this tilt goes further down, my spine actually has to curve harder back to get my head up above here. If I take away that curve, if I take away this tilt, my spine doesn't really have to curve back at all. It starts to straighten out. It may not disappear entirely, you're absolutely right. But it really does straighten out. You get this kind of military back.
Okay.
Yeah. In fact, and that is your body trying to compensate for the misalignment of your hips. Yes, go ahead.
Can you do that? Can you do the thing again where with the posterior tilt so we can see you?
Yeah. The problem is I don't think it's a very good view. But here, look, hold on.
If you go back to where the board is. Okay.
All right. So, and guys, the thing is, your posterior tilt can't go back that far. But really your hips run at kind of an angle like this. This is fairly normal, right? anterior tilt, my butt goes out, so my back has to get back over here, and so I start to really exaggerate this curve. This is anterior tilt, right? My butt's going back with the top of my hips going forward. This is posterior tilt. My butt tucks in. I don't need a curve in my spine anymore to keep my head above me, and so I start to straighten out.
That's the one that you said would be like the military shoulders?
Yeah, military spine or neck there, where it's straight. I mean, they'd call it that sometimes. And that would be from the hamstrings being tight. I mean, it could be from other things, but that's one of the culprits, right?
Okay.
Yeah.
Okay.
It can also be from how somebody's trying to compensate for other things. So depending on how you carry weight on your body and such too, it might affect. Like one of the things guys like me do where we're carrying weight up here, this is very uncomfortable to carry this weight here. So what I try to do, don't just get my head over my hips, get my belly over my hips. Walk around like this. It's attractive. Walk around like this, and what I'm doing.
You got your girlfriend, huh?
Yes, she's a sucker for that. She's like, that's the one I want. So, but the fact I'm exaggerating, but watch some guys with big bellies, big bay windows. They'll kind of hold that weight back here because now it's sitting over my body. Because this is hard. So we've got this weight here, and you kind of bring it back a little bit. I'm shortening my own hamstrings. This might cause other problems, right? And now on this one, I'm back here, I pulled my back. My head actually has to kind of go forward to help balance that out. So now I look super attractive. Look like this. Yeah. And by the way, when you're looking at somebody, these will be minor things. You'll kind of look at them and be like, he's kind of standing like Tapscott did, but it's just a little bit. Yeah.
Okay. So with the tummy thing, and you saying how compensate, so that's just because of the tummy. That's not because of any tilt that you have in the hips?
Yeah, well, I guess what I'm arguing is I think in this case the tummy came first and caused the hips, right? My body's trying to compensate for carrying the weight of the tummy around. Whereas other things might be my hips, my hamstrings were tight, or my rectus femoris was tight, and that caused other problems going up the chain. This is problems coming down the chain, right? It's very hard to say which came first, chicken or the egg, but in this case I'm saying the tummy.
That's what I'm asking is if somebody has an issue with their tummy, would you assume that they have an issue with
Yeah, it would be one of my big guesses. I would be like, especially if they're kind of walking that way, I'd be like, oh, this person is trying to compensate for this, and it's a very lazy compensation, by the way. But, you know, we all try to find, I don't know if you guys ever watch me walk. I have this very lazy walk. I actually waddle, because it takes less energy. So, you should walk like this. Do, 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 right? But I tend to do this thing where I hardly bend my knees and I do this. Conserves energy. It's lazy. I'm exaggerating again. But so somebody might, yes, maybe they've got weak spinal erectors and weak hamstrings. They've got to get this weight back here. They don't have the strength behind them to hold this stuff. Right? And so that's one of the things they're doing is getting the weight here so they don't have to hold it up. Yep, and that would cause further weakness back there because it's not getting the exercise it needs. And they'd be better off trying to stand in good posture and kind of deal with it. But yeah, cool. All right. We already talked about the biceps femoris. Remember, the biceps femoris is the unusual one. There is a long and short head. Long and short head. One head crosses over two joints. The other head only crosses over one joint, right? Yes. Good. Miss Torres, which head crosses over two joints of the biceps femoris? Which head crosses over two joints?
which bicep?
Yeah, biceps femoris has a long head and a short head. Which one crosses over two joints?
Yeah.
What?
The long head?
Yeah. And by the way, even if she was just guessing, I'm not saying you were, Miss Torres, but even if she was just guessing, the long head is a good guess because it's longer. It's got to get across both joints, right? All right, and what two joints does it cross? Ms. Torres, the long head of the biceps femoris?
Your knee joint and your hip.
Yeah, exactly. Your coxal joint, or your, wow, there's so many names for your hip. But anyway, your hip, your coxal joint, your trying to think of like acetabular femoral joint. All those are hip joints. But anyway, all those are the same hip joint, by the way. And then yes, your knee joint, which is your tibial femoral joint. Tibial femoral joint is the fancy name for that. I'm telling you that because eventually on tests you guys are going to get like, it won't say knee joint anymore. It'll say your tibial femoral joint. You're absolutely right. And which head only, of the biceps femoris, which head, Ms. Torres, only goes across one joint?
The short head.
Yeah! Which joint does it go across?
The knee.
Yes! What's the fancy name for the knee? Take tibia and put it with femoral.
You just said it.
Yeah, it's hard though.
Tibia. What is it? Tibia.
Tibial femoral joint. Tibia femoral joint. Tibia.
Oh, tibial femoral joint.
Yeah, we'll take that. Cool. Awesome.
Tibial femoral joint.
Cool. Boom. And then we've got the semitendinosus. This is the one found on the medial side of the leg. It's not quite as medial as the semimembranosus, but they're both found on the medial side of the leg. They both insert into the tibia. Just different parts of it. The semitendinosus is really long, comes around the back side of the leg, goes into the side, the medial side of the tibia, into the pes anserinus. Pes anserinus. Miss Bilotic, what does pes anserinus mean?
Have we been over this before?
Yeah, I haven't mentioned it a lot, Miss Black. Don't feel bad, but I did mention what it's called. Like the pes anserinus, it's what do I want to say to give you a hint? It means something. It has to do with a bird.
A bird?
Yeah.
Everybody in class, I want this to be my new nickname.
Pes anserinus?
No, the other words.
What? Oh, okay. It's the goose's foot. So it means goosefoot. Yeah, goosefoot. Because the semitendinosus, the gracilis, and the sartorius come together on that medial side of the tibia. In the place called the pes anserinus, which is very sore on just about every human being I've ever met, by the way. But it means goosefoot. Cool, cool, cool?
The knee?
No, you're done. Goosefoot was the answer I was looking for. You're cool. It is found on the medial side underneath the knee, but yeah, you're good. You don't remember pes anserinus, Miss Hunter? All right. So, Miss...
I mean, maybe I wasn't listening, but I don't recall.
Yeah. Well, I think
today. You ever going over that.
Today is the first day I ever mentioned it, if that helps.
Oh.
Right? But I did mention it today earlier. Yeah, I'm confused too. Miss Monreal,
Yes.
you want to be called
Yes,
Goosefoot?
I want to be called Goosefoot Montreal.
Yeah?
When you said that word, I just started laughing, and it will forever be stuck in my head. So hopefully, I will always remember what pes anserinus means.
Heck yeah.
So I can help you guys out to always remember that, for you guys just to call me Goosefoot Montreal from now on.
All right, Miss Monreal. I like that idea. Sorry, I'm putting together a skeleton here before we lose the parts. So, Miss Monreal?
Yes.
Oh, I'm sorry, Miss Goosefoot?
Yes.
What muscles make up the 3 toes of your foot?
Oh, shoot. Oh, man. Okay.
I mean,
okay, wait a minute.
it's your name.
Semi-tendinosus, semi-membranosus.
Whoa, 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 whoa!
Oh, what?
No. One is a hamstring, one is an adductor, and one is a lone wolf. It's not even in a muscle group.
Oh, shoot. Okay, so semi-membranosus.
No!
No?
No. Semi-membranosus is so medial that it grabs on the most medial thing it can on the tibia, and that's the medial condyle of the tibia. This thing is a hamstring muscle that reaches under the medial condyle of the tibia, grabs onto the medial side of the tibia, on the proximal medial side of the tibial shaft. It's that hamstring. It's still pretty medial, but it's not as medial as the semi-membranosus. Which hamstring is that?
Okay. I don't know, man. I'm just so confused now. I don't have my book in front of me. I have to go
Good.
get it.
I'm glad you don't have your book in front of me. That makes me happy. That's awesome. Well, what is the most lateral hamstring muscle?
Is it the rectus femoris?
Well, let's just stick with hamstring muscles right now, okay? What is the most
Oh!
lateral hamstring muscle? Woo.
Okay.
Mondays are hard. Yeah,
Okay, bicep femoris.
thank you. So it's not going to be the bicep femoris. We're looking for a medial
Okay,
hamstring
so
muscle.
semi-tendinosus?
Yes. So that is one of your, that is one, Miss Goosefoot, of your toes, is the semi-tendinosus. And it actually wraps around from behind the knee and goes in the medial side. You can actually feel it, everybody. If you get your, shoot here, come here. I feel like I need to demonstrate this. I really do feel like it's important. All right. If I take my, oh jeez, hold on. Whoa. All right, there we go. Okay. This is my left leg. This is the medial side. Right down around here, ow. You can actually feel the condyles up here, and if you go down below here, the pes anseritis is right here, and it's sore. I don't know why I'm the only person rubbing my leg right now, because I know where this thing is. You guys don't, but that's okay.
I'm rubbing it.
Good. All right, so.
I'm not gonna wiggle my camera.
Good point. Good point. All right.
Okay, so what about the adductors then?
So the adductors, there's only one adductor that crosses over the knee. And the pes anseritis is on the other side of the knee. It's on the tibia. So it has to be the adductor that crosses over the knee. It has to be the longest, not the biggest, but
Gracilis?
Yes! That is your other toe. So we got semi-tendinosus of the hamstrings, gracilis, yes, absolutely. And then we've got a lone wolf. So far, by the way, the goosefoot is down here, like this.
Okay.
Cool. You have described the semi-tendinosus, the gracilis. Now, what is this muscle here? It goes from...
Wait, can you go back to gracilis?
Sure, right here.
Okay.
That's on your inner thigh. This muscle, the last muscle, is one that goes from your... What?
Is that sartorius?
Yes, it is. That's very good.
Okay.
So that's cool. So look what these do, by the way. They triangulate the inside of your knee to protect it. To protect it from medially busting in. Just like your IT band protects it laterally.
So what is the sartorius classified as? I mean, we have the adductors, then we have the quads. So what is it? Okay.
It has no classification. It's a sartorius. It's a lone wolf.
Okay.
Yeah, I'm sorry. I was trying to just make a point, but
you did say that. You did say lone wolf.
no. That's totally cool. I like what you asked. But anyway, it's not part of a muscle group. It is the most superficial thigh muscle, by the way. Let me tell you a little something about it, just briefly, really, everybody. A lot of massage therapists rub up the leg like this, and they pop over it, and they think it's a knot in the quads. And all they're doing is they're kind of coming up here and popping over this muscle here, and they don't realize they're popping over the really thin sartorius, and it's not a knot. And they go back there and try to dig into it, and I'm like, it's not a knot. It's the sartorius. You're kind of coming up here, stretching it, and then popping over it. So,
Okay, how come
because
it's not classified with anything else?
well, tell me another muscle you'd like to put it with.
I don't know. I just would have thought it would. I mean, they obviously obviously wouldn't be the quads anymore if they added one more.
You know what, Miss
But
L'Oreal?
just because of the
You are right.
area-
We are going to put it into a group that some other muscles fall into, but we are going to put it into the pes and serenus group
Okay.
from now on. No,
Alright.
because of you. And I'm actually going to teach it that way from now on because I'm not joking about this because it's really helpful to put it with something. So it's now part of the pes and serenus group, which is composed of 2 other groups, but it's still part of the pes and serenus group, which is 3 muscles that come down the goose foot, or as I like to call it, the Miss Monreal. Right down here.
Okay.
Yeah. Hey, what 3 muscles make up the goose foot group?
Okay. Me, right? Are you asking me?
Yeah, I'm asking you.
Okay. So gracilis,
Yep.
bicep femoris,
Yep.
and sartorius.
Yeah.
Am I saying that right?
Yeah. Sartorius, yeah. Hey,
Sartorius.
of those 3 muscles, how many cross 2 joints?
Sartorius.
Definitely.
And the gracilis.
Definitely.
Okay. Oh, do all of them?
Oh! Well, let's see. The semitendinosus hooks back in the back of the hip, and it causes an extension of the hip and a flexion of the knee, so that sounds like 2 joints.
Okay.
So all 3 cross 2 joints. Is Tapscott obsessed with muscles that cross 2 joints? Yes, he is.
Seems like it.
They tend to be structurally important. They tend to be structurally important to the architecture of your body. So is the pes and serenus probably a really important thing to know about? Yeah, it is, because actually it's where 3 muscles come together that cross over both your hip and your knee. Yeah, super important stuff.
Thank you so much for the way you explain things and for being funny.
Oh, good. Thank you for not taking it personal, because I try to be sarcastic to make a point. I do not, I don't think any of you should know stuff or whatever.
It's funny sarcasm.
Good.
It's
It
not-
makes me laugh sometimes too, because we're like, it's hard to say this stuff and think about it, right?
Yeah.
You gotta laugh. You gotta laugh. You'll catch, if you guys listen, I'm sure you already have. I mess up a lot. I mix my muscles up a lot, and so I understand. And again, I've said this many times, but I will say it again, just so that you don't feel bad about yourself. I really mean this. It is one thing to know something in your head. It is another thing to have somebody ask you in front of a group of people and put it in their own words, and you're not ready for that question.
Yeah.
Like if Mr. Ibarra walked in here right now and said, hey, Tapscott, blah, 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 the way he says stuff, the way he asks stuff out of the blue, I'd be like it would take me a long time to tune in. What's he asking? What does he want? There's all these people, paying attention. I don't want to mess up, all that kind of stuff. So I expect it to not go well. I expect it to not go well.
I have a random question.
Yeah.
that I forget to ask you at other times. After we're done with this program, are we still going to have access to the lectures? Or does that go away?
It goes away.
Okay.
Yeah. Oh, actually, that's not true. Your access to Canvas would go away. But I think you guys, I don't think I made the access to the YouTube stuff private. I made it unlisted so that when people search it, they don't find it, because I just didn't want our classroom stuff out there for everybody. But anybody can access it. So if you guys write down the address to where that stuff is, or that channel, you would still have access to that channel forever. As long as we don't shut down the channel, and I'm not intending on it. So yes, to answer your question, yes, you will still have access to YouTube and the YouTube channels. You just lose access to Canvas, because once we grade you out, that's it. We post your grades and you're cut out of the course. That's it. It's cool. Good question. All right. Okay. Semimembranosus is right here. By the way, what do I want to say about this? Your book does lots of stuff about talking about medially or laterally rotating your femur with these hamstrings. And I hope that I don't think it's that big a deal, although it can matter sometimes in structural anatomy. But what they're saying is obviously the medial hamstrings can kind of pull the femur medially. And they say of a flexed knee because it works better when the knee's flexed. They have better angle to pull on. Don't worry about it too much. But that's why they're saying stuff like this, like they will medially rotate a flexed knee. basically, I'm sure it's both of them. Yes. The hamstrings on the medial side will medially rotate a flexed knee. The hamstrings on the lateral side will laterally rotate a flexed knee. It's when the knee flexes, they have a better way to grab and they can turn it better. That's why it says that. It's not a big deal. But does that make sense? Like it can steer the femur from side to side too. Just like it can control knee stability. Once your knee bends, it pulls, it can actually turn the whole femur one way or the other. That's all they're saying. Does that hurt your head? Ms. Petrie, I see you doing this. It's okay. Yes, no, maybe? You're okay? All right. It's a pretty nitpicky point. Don't get me wrong, it's important in structural anatomy, but it's getting pretty nitpicky. All right. Okay. So, let me stop sharing here. I'm going to make another point to demonstrate the medial rotation, and then we'll take it from there. Stop sharing. Boom. Okay. Let me see if I can get something to, I don't know, hold on. Bear with me. Good. Okay. Let me see if I can make a point here visually that'll make more sense for you. Let's see. Let's take a look at Mr. or Miss Skeleton. There we go. Can we all see the skeleton? The lower part of the skeleton? Okay. Let's suppose this is actually the semimembranosus, right here. I'm going to make a point about medial and lateral rotation, that's all. If this thing pulls, it will start to, actually it's doing it right now, it's starting to flex the knee or extend the hip. What the book is saying is once it's flexed like this, if it pulls, it can also kind of medially rotate the femur, which is really hard to see. And I actually even argue with some because I kind of feel like it should laterally rotate it. But the real point is once it's flexed, it's got more leverage to then rotate the hip. I really wonder about that, by the way. Shouldn't it laterally rotate? Does anybody understand what I'm saying and why I'm arguing with the book? Does anybody care?
I, for one, am just kind of confused.
Yeah.
Well, I feel a little bit confused. So, are you saying that the pelvis, like the hips, actually tilt as well?
No. Well, the hips can tilt, but we're talking about medial rotation of the femur. So, can you see?
But your hips only does a pelvis tilt only go interior and posterior?
No, it actually can do what's called lateral tilting, where it's up high on one side as opposed to the other. You see it on moms a lot when they're holding a baby. That is a lateral tilt. But if it's permanent, look what had to happen to my spine, by the way. I had to kind of develop scoliosis to deal with this.
And that's a tilt of the hip?
That's a tilt of the hip.
Okay.
I'm just talking about why your book talks about the fact that your femur can rotate in and out. My leg can twist back and forth. And if I grab onto one side of my knee and pull it, the femur will twist in. If I go on the other side, it'll twist out. I can't show you on this one because the skeleton has a screw in its socket. But just like my arms can medially rotate and laterally rotate, my legs can medially rotate and laterally rotate. Let's go again here. I am not really turning in my feet, I'm turning in my thighs. My feet are following. I am laterally rotated, right? My thighs are rotated out. The book says your hamstrings on the outside of your thighs can help to laterally rotate them. And your hamstrings on the inside of your thigh can help to medially rotate them because they're kind of pulling them in towards the center a little bit. But this is rotating of my thigh. Lateral rotation, medial rotation. Because my hip joint is ball and socket, it can do just about anything at once. I was arguing with the book about which way it would pull. I was arguing that the medial hamstrings would actually cause a lateral rotation, which is just confusing you guys right now. Yeah. Sorry, I'm looking back at the thing. I definitely agree the biceps would create a lateral rotation. Okay, so that's helpful. So look at this. Here's your biceps femoris long head. Comes way down here. Can we see that if it pulled, it might cause your leg to laterally rotate? Does that make sense?
We can't see.
Yeah, I just realized that. I looked up the
Yeah,
thing and I'm like,
it does.
okay. You've got this biceps femoris long head. It's on the outside here. Attaches down here. So can you see that if it flexed, it could also rotate my leg out? I know this leg's coming in, but my femur goes out. That's what they're talking about.
I can see that.
Good. That's what they're talking about with their rotation. And they're saying the lateral hamstrings rotate your leg out laterally, like the biceps femoris there, and the medial ones, the semimembranosus and semitendinosus, medially rotate the leg. It's exactly what you'd think, so don't overthink it. I was overthinking some of their interpretation of medial ones, but don't worry about that. That's it. Questions? Thoughts? No? I know it's Monday. Yeah?